My name is Sankaran K. Ramakrishnan. I'm a consultant in respiratory and sleep medicine at Nelson Hospital in New Zealand. I'm going to talk about the alternative treatment options for obstructive sleep apnea in addition to Cpap therapy. As an alternative or in addition to Cpap therapy, the traditional treatment aim for treatment of OSA is to reduce the resistance in the upper airways. This is effectively done by Cpap, but sometimes people may not tolerate it very well or may not want to go on to Cpap therapy. Then we have to think of alternatives or think of additional therapies in place of Cpap or in addition to Cpap, where the Cpap is not giving a full response to the sleep apnea. So the alternative therapy to Cpap includes, one is oral appliances. These are basically mandibular advancement splints or tongue stabilization devices. You can have upper airway surgery, or you can go for weight reduction. All these can be used in addition to Cpap, or you have to use in alternative to Cpap. There are some newer approaches available which are targeting the neuromuscular mechanism and also the neuroventilatory mechanism, but these are some of the things which are being tried and studies are being done, and sometimes they are effective and sometimes they are not. So I'm not going to talk about oral appliances or upper airway surgery, which probably is beyond the scope of this module, which might be covered later on as a separate topic. I'm going to talk about weight loss. There are two ways of losing weight. One is a medical way and the other one is by surgery. So medical way is basically dieting and exercising. Surgery is where you go for restrictive or bypassing the normal anatomy of the stomach so that you reduce the absorption of the calories through normal digestion. So the reason for weight loss being effective is that obesity leads to excess fat collection around the upper airways, and this alters the airspace geometry. So normally the airway has to be wider from lateral to lateral position than to anterior-posterior position, but as the fat collects along the pharyngeal muscles, the lateral to lateral diameter gets reduced and the AP diameter actually becomes relatively longer than the lateral diameter. So when the patient goes to sleep, they lie supine, the tongue falls back and it occludes the airway. So that is one of the reasons for having sleep apnea, which is more severe in the supine position. It also reduces the functional residual capacity of the lung. If you reduce the functional residual capacity of the lung, that means the lung is not expanding fully. If the lung expands fully, it applies a traction to the trachea, but this is lost because the FRC is reduced. And there is also external mass load on the airways by excess fat deposition around the neck and also on the thorax. So medical weight loss. So the reduction in the severity of OSA by medical weight loss, that is dieting and exercise, is dose dependent. So the more weight you lose, the less severe the obstructive sleep apnea becomes. So if you can lose 10 to 20 kilograms of weight, the severity actually reduces by approximately 50%.